Great saphenous vein incompetence, medial circumflex femoral vein and external iliac vein competence during Valsalva. A young female patient, 31 years old, an opera singer, came for a consultation, mainly for aesthetic problems of the lower limbs. Teleangectasiae and lipodermatosclerosis were clinically evident. An asymptomatic bilateral P-point pelvic shunt was demonstrated by the EchoDoppler, while no nutcracker syndrome was detected. A Haemodynamic Venous Map of the left lower limb was performed to detail the features of the venous network. You can see highlighted in red a medial circumflex femoral vein, the common femoral vein, and then the GSV. A computer simulation showed the flow behavior over the mean of a systo-diastolic manoeuvre. A longitudinal section of the saphenofemoral junction showed the valves, from left to right, ilio-femoral, epigastric, saphenofemoral junction terminal and preterminal ones. The exam here detailed was not perfect. The sample volume was correctly positioned at the level of the saphenofemoral terminal valve, but not exactly over the flow. In the registration at the iliac level instead, the angle direction was not along the flow. The Valsalva manoeuvre showed a GSV terminal valve incompetence. A dilated medial circumflex femoral vein at the level of the saphenofemoral junction was the source of the reflux through the GSV, while the external iliac vein was competent, but a manoeuvre was always negative. Flow in the medial circumflex femoral vein was directed towards the common femoral vein, as in the hypertensive as in the relaxing phases of Valsalva. Hypertension was only the cause of the deviation of flow from the anterograde direction into the iliac vein towards a retrograde flow reflux into the GSV. The GSV reflux with Valsalva was present only in the laying position, while it disappeared in the standing position, when before the Valsalva the valve leaflets were already in tension at rest, bearing the weight of the hydrostatic column, so that during the Valsalva the excursion was less wide. The exam shows clearly that a GSV reflux can sometimes occur in absence of iliac reflux. The circumflex femoral veins, medial and lateral, are anatomical variations, but also common findings during ordinary EchoDoppler investigations of the venous system of the lower limbs.
Uressa deve andare su ricillo nennane, uressa deve andare su ricillo nennane.